Good afternoon. My name is Andrea Gossard. I'm a nurse practitioner with a clinical practice in hepatology, and I work at the Mayo Clinic in Minnesota. I am joined today by Ann Moore.
Hey, everybody. I'm Ann Moore, and I'm a nurse practitioner with Arizona Liver Health in Phoenix, Arizona.
And we're going to talk with you a little bit about managing patients with primary biliary cholangitis. I think both Ann and I have a number of patients that we follow for this condition, and so we probably have similar things that we struggle with. And so we'll chat a little bit about those today. So obviously, this is a chronic liver condition that is very important to treat and to manage. But for a lot of patients, their primary concerns really pertain to sort of their quality of life day to day. One of the challenges we have in front of us oftentimes is managing either their itch or their levels of energy. And what are some of your strategies for managing pruritus in the setting of PBC?
Well, I feel like, number one, when you have a patient with PBC, sometimes we're so focused on the clinical picture that we forget about the patient that comes with the disease, right? And you're absolutely right. Itching and fatigue are two of the most, frequently mentioned and most difficult to manage, conditions associated with PBC, but so important for improving patient quality of life. And itching in particular, like when we talk about itching, I don't think that people truly understand what itching is to a person. I think the pruritus and itching is almost a misnomer for what happens to patients with PBC. When you hear them describe it, it's like an itch that they can't scratch. It's like ants crawling under the skin. And, if it was an itch that you could put something on topically or scratch and relieve, but this is not the itch they experience. And so I think it's so important for clinicians to, number one, understand that and try to take a moment and think about what patients are going through when they're experiencing it. And granted, pruritus waxes and wanes during the disease course, but I think it's a question that always needs to be asked of the patient. And sometimes, because sometimes they won't volunteer because it's just a way of life for them, right? So there's a lot of things you can try to do to improve itching in PBC patients. And starting with skin hygiene, I live in the desert, and so it's very dry here. So hydration, really emollient skin lotions without fragrance or alcohol in them, super important as a start. But above and beyond that, it's, a hit list of tricks to manage pruritus that both with the guidance and both with years of experience and also with years of experience that you kind of learn to try. And I think the important thing as a clinician is not to give up. Like if one thing doesn't work, try the next thing or try to load on top of what you've tried. But, starting with the guidance, it's cholestryramine, it's rifampin, it's naltrexone. I think sertraline has made it in there. But I have other things, there's other things that are both studied and not studied that, on and off label that sometimes we use. A lot of my patients don't want a prescription medicine. So it's, what can we use over the counter? And there's a lot of anti-itch things that you can go through the aisles of Walgreens or CVS or whatever your local drugstore is and find things that may topically help with itch, like cooling things or sometimes it's just an ice pack. Like, I don't know. What do you do? Maybe you have better idea of how to deal with this than I.
Well, in Minnesota, we don't quite have the same degree of dryness, except in the winter when there are so many, heat is on high to try to protect us from the -7 degree weather that's outside. But yeah, similarly, I escalate therapy kind of with that, approach of cholestryramine first and really maximizing that and then moving on up from there with the same sort of lineup that you referenced. Patients sometimes have those tips and tricks that they use to try to mitigate the impact because, for some, it's truly life altering. And I think, it can be quite a challenge to try to arrest the degree of pruritus that some people are experiencing. And sometimes we really, despite our best effort, it's just an ongoing day-to-day challenge. So it can be a very frustrating symptom. And unfortunately, as you'd referenced, for some, this is a much bigger issue than really their sort of their PBC management is how is, not so much what is their alkaline phosphatase level doing, but, how well is their itch controlled. But, beyond the itch, I even am more challenged oftentimes by fatigue because we really, I feel I have such limited sort of, options or suggestions for managing that. I do the standard, do what you can to maximize quality sleep, to exercise regularly, to ensure that, you're doing all you can to kind of, promote, feeling as refreshed as possible. But I find that even with those suggestions, sometimes the fatigue is just equally life altering as the pruritus.
Right. No, I agree. Like the itching or the fatigue is like bone crushing fatigue. It is not the fatigue that you or I get when we've worked a long day. It is
Yeah.
entirely different. And I think so frustrating for patients and their families. Like just to get through a day is sometimes difficult for our patients. I feel hopeful with some of the new data that we're seeing from the PBCers that were FDA approved for PBC this year.
Yeah.
Interestingly, I always connected that fatigue with maybe my patients weren't sleeping because they itch at night, right? But it seems like in some of the data that's now coming out with the extension of the clinical trials, is that it's not related to sleep, the fatigue or to itch. So the itch may be going on, but fatigue is a wholly separate issue. And I think that's important for me to get in my brain. But you're right. We really don't have anything other than, good sleep hygiene. And, frankly, the patients don't want to hear that. Like, decrease your caffeine intake after 3 p.m. No, that's not what they're looking for when they're talking about sleep. So I think one thing that I find helpful is getting my patients involved with one of the PBC organizations so that they can connect with other patients, because sometimes patients have the best suggestions in terms of managing the symptoms of their disease. And, as clinicians, we can say what we've heard over the years, and yeah, we might have some good thoughts, but there's nothing like a patient who's in your shoes to talk to and commiserate with. And I think there's a lot of good organizations out there. So we can't not say enough about getting patients connected if they're interested to discuss their day-to-day symptom management with other patients going through similar issues.
I completely agree. I think the PBCers has really been an excellent resource for individuals newly diagnosed, as well as those that are maybe further along in the journey. I think the American Liver Foundation and, of course, ASLD and GHAPP, having resources for patients. These are really phenomenal when people are seeking that really expert input on how to best manage the symptoms that come their way. But I also agree that having these sort of support groups, people that can share their experiences, is oftentimes really encouraging to our patients, again, particularly those newly diagnosed and starting out on this journey. I think the other thing, to your point, I think that oftentimes there are things that, maybe have worked for individuals, like to your point, that we haven't necessarily heard about, sort of home remedies that might help with the itch or to give people a little bit better energy. And I think that that's, certainly something that, learning from colleagues and associates that have, kind of walked that line, that can be a benefit.
I think in steering my patients away from Dr. Google and getting them to a vetted, organization where they're highly involved with practitioners who are, working with patients with PBC. I mean, they attend our meetings. They're, they try to be very scientific and up to date and very careful about the information that they're sharing amongst themselves. So I feel better when I can connect my patient with a legitimate resource that also includes patient advocates for disease management, right, and symptom management. So that always makes me breathe a little sigh of relief because Dr. Google is a real thing with a lot of my patients, and the advice is not always sound. So feel a little much more reassured that there's great advice out there with advocacy groups. who stay immersed in the science, right?
Yeah. And I think for clinicians like you and me, where, this is what we do every day, manage patients with chronic liver disease and try to provide that, that advice and those helpful recommendations, obviously, hearing out each patient and understanding their unique journey is essential for us to be able to meet them where they are and hopefully meet the needs that they have. So, obviously we'll use all these tools in front of us, but at the end of the day, it's just the provision of care that we, really is kind of at the base of all that we do, and making sure that we're working to try to make their quality of life better.
Exactly. And I think, as APPs, we are well suited to assisting patients along their disease management journey. We get the idea that this disease does not impact every patient the same way. And I think we really do an excellent job of meeting the patients and talking to the patients about what's bothering them. And it is not the same for every patient, obviously. And I feel like we focus on quality of life and trying to improve that in really every patient we see. That's the goal. Sometimes, quality of life may be more important than hitting those PBC targets in some moments. So we never lose sight of that. I think that's important.
It's an exciting time. I think about the number of years I've worked with PBC, even through the name change and then the development of sort of a second agent and now 2 more in 2024. I think that we have every reason to be optimistic with respect to where things are going for our patients with PBC. And I look forward to participating with people like you, Anne, in that journey and as we manage these patients together.
So I guess that's it for our PBC chat today. Thanks everybody for listening, and be sure to visit the GHAPP website or the app.
The ACE app. Please consider downloading that so you have access to all of these tools and discussions. Thank you, everyone, for joining.